In a Fox Carolina safety alert, a new report finds the U.S. is in a class of its own because our healthcare system is that bad for a wealthy country. This is a chart by the Commonwealth Fund, and you can see we sit far, far behind, all the way at the bottom right there compared to other countries. The report finds we are sick and unhealthy, yet we spend trillions on our healthcare system. So what exactly is going on? Well, I am joined by Dr. Nita Bajor. She's a family physician here in Greenville at Oakview Medical Associates. So thank you so much for joining us
Thank
today.
you for having me.
I think the big question is, why is America so far behind? What is going on?
Yeah, our system is clearly broken. There are several factors that contribute to that. Number one being high cost. We have the highest cost. We spend about $5.2 trillion, which is 20% of our GDP. In 1960, we spent only 5% of the GDP. Hospitals actually make about 1.6 million to 2.7 million per employed physician annually. That is insane. So those rising costs just cannot sustain. Number two is lack of access. Our patients, our underinsured patients, don't have access. So guess what? They don't go to the doctor's offices, they get sick, they go to the ER, they get admitted, and that increases the cost. Also, there's lack of or fragmentation of healthcare, where physicians cannot own hospitals, but insurance companies can own hospitals, and insurance companies can own PBMs. It's a totally messed up system. Number four is we focus on treatment instead of focusing on prevention, which is a big one. And that, we can see in every aspect of our healthcare. So I think the other factor is rules and regulations, a whole complexity of rules and regulations. And another factor is overall cultural beliefs and or disbelief in our healthcare system or our government. So several factors there.
Yeah. And the graph we were just showing, that's kind of all the middlemen in the system. That was the administrative people, the number of people in the administrative positions who have grown, whereas doctors, you guys have just kind of stayed steady.
Yeah, 50% of our healthcare costs goes into bureaucracy, administration, rules, regulation, and compliance. 50%,
wow.
yeah.
Not going to the patient, not going to us. Okay. So this report, it said that high-income countries that had the worst healthcare, that was us, Switzerland, and Germany. You can see that on your screen here. Now, countries with the best healthcare system, that was Australia, the Netherlands, and the United Kingdom. So I want to know, what is Australia and the Netherlands doing that we're not?
Yeah, number one, I think, is most of these countries have a universal healthcare system where everyone has access. Everyone is able to see the physician, get care. Another factor is that they focus on prevention and they focus on community-based strategies to improve health of their population. They don't have the administrative burdens that we do. We have a very complex system that physicians cannot, they don't even have the time to understand. We have the highest denials in our system. So if we, treat a patient, we get a denial, and then we have to spend time in explaining why we did what we did. I mean, we shouldn't have to do that. We are trained, we're board certified, and so it's very unfortunate. It's causing physicians to leave healthcare and pursue other opportunities. And I fear that we'll have such few physicians and we have a big aging population, it just won't be able to sustain. So a lot of factors there and things we can do to improve, just overall communication, investing in good telehealth technologies, making sure that our physician to physicians communicate very well. That doesn't happen. Each hospital system has its own EMR. And so that, just is very disconnected.
And as you were saying, in the hospital setting, it can be very expensive. Just so much of the expenses there. Whereas I know it in a doctor's office, if it's a private office, it can be a lot cheaper for a scan, like an MRI or something like that. So how do you find those places where you can get cheaper health care?
That's a great question. There is lack of price transparency. So the insurance companies pay something called an allowable fee to the provider. So the allowable is different for a hospital and different for a physician or a private practice, which is just not right because both systems have physicians that are providing the care. So that increases the cost. And so, for example, an office visit is much cheaper in a doctor's office, in a private freestanding facility, as opposed to going to a hospital-based practice. So our CTs, MRIs, surgical procedures, a lot of surgeons are actually going out of insurance and just providing direct care because patients want that transparency. Patients want that choice. They want to be explained, you could go here. They don't want to be limited to the employed physician they see, thinking, oh, I'm seeing this physician at this practice in this hospital, so I have to have my MRI there, I have to have my surgery there. That's not true. They should be given the choice. Also, this complexity of in-network and out-of-network, that just we're all physicians, we're all board certified, we're all licensed in our state.
Yeah.
So there shouldn't be a difference between seeing somebody in network with the insurance company and out of network.
Well, we have a lot of work to do in our
Yeah.
healthcare system, a lot of issues, a lot of middlemen involved that
Right.
don't help us in any way. So thank you so much for joining
You're
us.
welcome. Thank you.